Hello, greetings from the OECD. My name is Eugene Choi, and I'm a policy analyst working for the Test Guideline Program at OECD. It is my great pleasure to welcome you to the webinar on OECD Test Guideline 497, especially for the derivation of point of departure for skin sensitization risk assessment using SARA-ICE DA. Welcome, everyone. Before we start the webinar, just a few housekeeping notes. You are very welcome to submit your questions at any time during the presentation using the Q&A feature. And the chat function is only working between the participants and the panelists, but we really encourage you to submit the question through the Q&A rather than the chat, but if you have any technical issue, we will respond there. And to inform you, the webinar is being recorded and will be made available on our site later. Okay, then without further ado, before I invite the speakers for today to enlighten us on the use of a SARA-ICE DA for quantitative risk assessment, I would like to give some general introduction on OECD test guidelines, mutual acceptance of data, and the defined approaches for skin sensitization now in test guideline 497. So OECD is an intergovernmental organization with 38 member countries promoting evidence-based policy recommendations to its member countries. OECD also develops policy acts and tools that can facilitate more seamless and barrier-free international cooperation among its member countries. Mutual acceptance of data, also known as MAD, is one of such acts, which is a legal agreement among all members and partners countries that share a common data requirement to accept the data generated by other member countries. To qualify for MAD, the data must be generated according to an OECD test guideline under good laboratory practice as defined by the OECD Council Act established in 1981, as you see there. So OECD test guideline program publishes test guideline across 5 different sectors. So section 1 in physical chemical properties, section 2 in effects on biotic systems, section 3 on environmental fate and behavior, section 4 health effects, and section 5 for other miscellaneous topics that are relevant for the test guideline program. Since our establishment in 1981, test guideline program has published about 200 test guidelines that are actively being used for regulatory acceptance of data. And we currently have 66 active projects aiming to either publish new test guidelines, revise an existing ones, or to publish other documents that are relevant for the program, such as guidance document, detailed review paper, and so on. The Test Guideline 497, which is the subject of today's webinar, is under section 400 for human health. So one thing about Test Guideline 497 is that it was the first test guideline that was adopted, including defined approach. And while I assume many of you know what the defined approach is, just to give you a bit of a background history, that it was really a concept that was born within the IATA framework as one of its building blocks. And you can see it in this figure that was taken from the OECD document on overview of concepts and available guidance related to IATA. What is special about defined approach, apart from IATA, which gives a flexibility to its building blocks, as well as how it can be combined to get the results that is desired for the different regulatory needs. For defined approach, the information sources, so the building blocks has to be defined, and also how they are combined to get into the prediction, also known as a DIP, also needs to be defined. So it is a rule-based approach, so there's no expert judgment required, and it can be used within IATA, but also it can be used on its own. Since there's no expert judgment required and everything is fixed, that means it can be standardized. So it can be adapted to a test guideline and also falls under the binding agreement of the mutual acceptance of data. So why was it the first with the skin sensitization? I think there are many, especially our speakers can really tell you in-depth history about it. But the skin sensitization is a quite special endpoint that has a very well-defined adverse outcome pathway. And according to that adverse outcome pathway, also known as AOP, different K-event-based methods were developed and adapted in test guideline program. So already there were availability of many different methods. And also it stands out as an endpoint with a lot of data available. So it was possible to have a very rigorous curation of a high quality data that could be used to build the defined approach. And you can see more about where it goes back from the guidance document on reporting on defined approach and individual information sources to be used within IATA for skin sensitization, which was published in 2016. So many call the test guideline 497 on defined approach on skin sensitization a success story for NAMS, but it took a long way to get there. So as you can see, in 1981, the first in vivo test guideline for skin sensitization, TG406, was adopted. Followed by more in vivo test guidelines adapted based on LNAA in 2002 and 2010. And 2012 is when the AOP was endorsed at the OECD level, the AOP for the skin sensitization. And following that, within the span of 2 years, many methods were adopted in a key event-based test guidelines as you can see, building towards a standalone NAM-based test guideline that can replace the in vivo data. And in 2021, there was a celebration of the adoption of the very first test guideline based on the defined approach that could replace the in vivo test guideline. So the initial adoption of the test guideline 497 was in 2021. At the time, there was 2 parts in the test guideline. Part 1 dedicated to hazard prediction and part 2 dedicated to potency prediction. This achievement really highlighted many different aspects. So as I mentioned, it was the first test guideline with the defined approach. And it was also the first test guideline including human reference data that demonstrates that DA combining NAM's test method could provide a superior performance compared to an in vivo test data, here referring to LNA data. And it was also the first test guideline where a QSAR model, an in silico information source, was included in the test guideline. And then just this year, we had another cause for celebration coming up with the revision of the test guideline 497. So there were 2 projects which one of our speakers led both of the projects. And the part 1 and part 2, which was already included in 497 for hazard and potency prediction, was expanded to include all the other methods that were from the same 442 series key event-based test guidelines. And then there was the addition of the part 3 on quantitative point of departure with the inclusion of a SARA-ICE DA based on Bayesian statistics. Not only does it mark the first DA included for the part 3 of the test guideline 497, but this is also the first fully in silico implementation of a defined approach. So with that, I will not go further because I think we have more exciting stories to hear from our speakers today. But just to inform you, the guideline 497 is easily accessible on the web. You can simply Google the guideline. And also all the documents for test guideline including validation report, the supporting documents, for example, for the test guide 497, all its annexes, they can be found in this website, publications on testing and assessment of chemicals. So if you would like to browse them, there are many documents there. Yeah, you're welcome to visit these sites. So with that, now it's my great pleasure to introduce the speakers for today. So we have two speakers, Emily Reinke, a principal toxicologist from Innotiv based in the United States. And we also have Georgia Reynolds, who is a safety science leader from Unilever based in the United Kingdom. And they will walk us through about all the hard work that went into adopting the SARA ISDA in Test Guideline 497. So Emily, please take the floor and everyone enjoy the webinar.
Thank you so much for that kind introduction, Eugene, and for laying out the basis of everything that we're working with from here. And as you said, it was definitely a lot of work moving forward. And we're very happy that we've actually gotten to this point and that we can celebrate the success of getting SARA ICE into Guideline 497. So I guess whenever you're ready, if you could go ahead and share the slides.
And coming. Always the most difficult part.
Right? Yeah, it's like, get technology to work, please.
Yes. So, now I have to share. Normally it should be coming up soon.
All right, perfect. See it now.
Okay.
All right, so thank you so much, everyone, for attending today and checking in to see a little bit about how we are or what we've done to bring this new method into Guideline 497. Next slide, please. This will be a tag team presentation between myself and Georgia Reynolds, and so we'll just be passing it back and forth to talk about different aspects. We'll talk a little bit about the background, going in a little bit more detail into the definitions around skin sensitization, talking about the skin sensitization AOP, and the development of Guideline 497. And again, Eugene laid a really nice background on that, and so I'll just emphasize in additional areas where make sure that we're up to speed on everything. Then we'll go into the development of SARA ICE. Georgia will cover that, a little bit about the model, the versions, and the user interface. Then I will take over and do a quick walkthrough of the Guideline 497 version of SARA ICE. There are a couple of different versions that are available for users, but there's only one that's applicable under MAD. And then Georgia will take it back over to do a case study of how a potential risk assessment could be done using SARA ICE as point of departure. Next slide, please. So for those that are not fully aware, what is skin sensitization? Well, that is also known as allergic contact dermatitis. Those are going to be things like rashes, eczema, anything like that where you have a physical reaction on your skin surface. Because of this, that's a major testing requirement in cosmetics, pesticides, industrial chemicals, and a wider, pretty much every industry has some interest in understanding what the potential for contact dermatitis is. We mostly hear about it for cosmetics and personal care products. However, again, it does span multiple industries. Sensitization has historically been evaluated using the murine local lymph node assay or the guinea pig maximization test. And with these, we know that they're not fully predictive. And so this is where a lot of those in vitro methods that Eugene covered earlier come into play in providing better coverage and better predictivity in a human relevant manner about skin sensitization potential. Using something like an adverse outcome pathway, we can get both the induction, which means that is the initial exposure to a chemical, and the elicitation. In that adverse outcome pathway, the elicitation would be what you would see happen after a second exposure to a chemical or other substance. And that is covered initially by the covalent binding of proteins. Next slide, please. So again, our motivation for this is that we're looking at about up to 20% of the general population suffers from skin sensitization reaction. And additionally, we have regulatory frameworks that are asking for information on predicting skin sensitization potential in humans. So, really, this is an opportunity to bring those non-animal approaches with an understanding of human biology using the adverse outcome pathway. So what we have here below is just a quick what a generalized AOP looks like. You have something that's related to the chemical structure and properties that then causes some molecular initiating event, which results in a cellular response to an organ level response to an organismal response. So that would be like your actual dermatitis. Next slide. So this is the skin sensitization AOP that we're looking at here. And again, we have that generalized AOP lane on top. And we can see that when we're thinking about the chemical structure and properties, we're looking at things like what is the metabolism potential of a chemical? What is the penetration potential? Does it become an electrophilic substance? That is what is necessary to understand if we're going to have that first key event, which is that molecular initiating event. And in skin sensitization, that's a covalent interaction with skin proteins. Then once that happens, you can have key event 2 occur, keratinocyte response, and that's in fact activation of inflammatory cytokines, induction of cytoprotective genes. Then we go into key event 3, which is your induction of inflammatory cytokines and cell surface markers, mobilization of dendritic cells that can lead to a more organ level response. So that's going to be T cell proliferation. You get the histocompatibility complexes presenting to the DCs, activation of T cells, and proliferation of those T cells. And that's going to be covered in one of our animal models. And then you get the organism level response, which is that adverse outcome, inflammation and potentially a rash forming. Next slide, please. So here we have how the different test methods map to the AOP. Eugene showed this briefly earlier, but we have in that chemical structure and properties, we have things like the in silico tools, such as the OECD Toolbox and DEREC, which are included in Guideline 497 as part of the ITS defined approach. Then we have our 442C series, which is the DEPRA, ADRA, K-DEPRA, the 442D, keratinosins, leucins, and episens A, and 442E, HCLAT, USENS, IL-8, and GUARD skin. Then we go into the in vivo test methods, LLNA and GPMT. So where we're going to be focusing is on that earlier set of key events between key event 1, 2, and 3 in developing those defined approaches. So next slide, please. Eugenia already covered this really nicely about what is a defined approach for skin sensitization. Again, just to remind you, it's a fixed data interpretation procedure, which means that if you give 5 people the same set of data and they go through the data interpretation procedure, they should get the same outcome every single time. So it's removing that expert judgment that's needed to make a call. Whereas something like an IATA, you may get the same data coming into it, but based on the expert's understanding of the chemical or their need for greater protectiveness, they may make a different decision about whether it's a hazard or not versus using these DIPs. And they are not flexible. So this is, again, really a good way to bring these more complex data interpretation procedures into a regulatory paradigm. Next slide, please. So again, we've already seen this slide, but again, where I really want to focus is the fact that the defined approaches for skin sensitization only focus on those first 3 key events and the in silico method. So we don't really use the LLNA or the GPMT in any way within the DAS, although SARA-ICE can actually take LLNA data to be used. It is not reliant on the generation of that. So, just something to keep in mind. We prefer to see only the in vitro methods being utilized in this way. Next slide, please. So again, already covered this in a little bit, but there are a lot of different types of defined approaches out there. There's, things like meta models, regression models, the integrated testing strategy, a 2 out of 3 consensus. So things that rely very heavily on computational inputs and predictions, such as SARA-ICE with like a Bayesian network. We've also, with some of the other skin sensitization defined approaches, there's artificial neural networks. Again, the regression model is something that's under evaluation right now. And then we have things that are a little bit more test method based, like the integrated testing strategy, the 2 out of 3 consensus, where there's a lot more reliance on just the in vitro inputs. Next slide. So again, as Eugene mentioned, in 2021, we had the initial adoption of OECD Guideline 497, and the 2 types of defined approaches that came out of this were the 2 out of 3. So this is a defined approach that is entirely reliant on just those key event-based test methods. What you're looking at is a concordance of assays. And so you're looking at 2 out of the 3 need to say the same thing. So if you test the DPRA and the HCLAT and they both say it's a skin sensitizer, you don't need to do something in the keratinosense, you know it's a skin sensitizer. Now, if those disagree, that's where the 3rd assay comes in order to make that final decision. And so this is going to allow us to discriminate between a sensitizer and non-sensitizer, make that hazard prediction. Whereas the ITS is discriminating between a strong and a weak or moderate sensitizer. So those are those GHS potency categories. These are dependent on the key event 1 based test methods, the key event 3 based test methods, and also those in silico models, Derek and OECD Toolbox. How the in vitro methods are utilized is looking at a scoring system. So the more potent the response in the DPRA, so the greater the % depletion, the higher your score is going to be. Same with the HCLAT, the lower the test concentration is going to be, the higher your score is going to be. And so, you know, really taking that dose level effect, and not like the DPRA, it's not a dose, but like that full effect that's coming out of those methods into the scoring system. And then the in silico is just a hazard, it's a yes, no. You combine all those scores together into a final outcome to make a prediction of, you know, 1A, a 1B, and NC. And then there's also allowance for partial information sources in there to be able to make those predictions as well. So if you only have key event 1, key event 3, you can make a 1A prediction, you can make a 1B prediction, but there's kind of a middle ground where you're like not sure if it's a 1A or a 1B, so it's just a 1. And then there's also an inconclusive. And then same thing, if you only have one of the in vitro test methods and in silico, you can make calls that way as well. And with that, I will pass it over to Georgia.
Thank you, Emily. So Emily and Eugene have given a really nice overview as to where the test guideline 497 took us up to in the original 2021 publication. But what that original guideline did not include was a continuous metric which could be used as a point of departure in skin allergy risk assessment. So what we mean here is something that could be used as a NAM-based point of departure to replace a, for instance, human-derived NESL or a mouse-derived LNA NESL, for instance, in a quantitative risk assessment. So the visualization you've got here is a QRA construct, but you can also have sort of acceptable margins of safety, acceptable margins of exposure constructs as well, where you would have a NAM pod, some kind of uncertainty factor, such as a SAF divided by your local dermal exposure. And that would allow you to do some risk calculations. And the guideline didn't really allow for defined approaches that were NAM based that would allow us to do this. So next slide, please, Eugene. So in 2021, Unilever and NICETM began a collaboration to work and develop a version of the SARA model, which was originally developed by Unilever, into something that was more broadly applicable for regulatory use and not just for the cosmetics industry. And in parallel to that, we also began this US and UK joint-led feasibility study project under the OECD for evaluating a defined approach that can provide that point of departure for quantitative risk assessment. And as both Eugene and Emily have pointed out, we were successful in the evaluation of SARA RISE for that purpose. And so the update was then released in June 2025, which is why we're here talking about it today. Thank you. Next slide, please, Eugene. So I'm going to give you a little bit more of an overview about the SARA RISE model itself now. So as I mentioned, this was a model that was developed in collaboration between Unilever and NICETM. And the aim was to develop this model that could integrate a weight of evidence across NAM data to define points of departure for risk assessment. Originally, there was also the idea to develop this model to also do that functionality of regulatory classification. So those part 1 and part 2 of the guideline for hazard and subpotency categorization. But that part of the model, we're not going to focus on too much today, because the point of departure version, the SARA ICE-DA, is the one that is included in the guideline. So we're going to focus there. So the SARA ICE model is based upon a database of over 400 chemicals. There are 1,400 plus in vivo studies in this database and over 2,500 in vitro studies. And it's largely based upon the Nicetum ICE database. And there's a QR code there if you'd like to find out a little bit more about what the ICE database is. The SARA ICE database is a fixed database, so it doesn't change, and any changes to the SARA ICE database would obviously incur a re-evaluation of the model for the purposes of the OECD guidelines. So that's an important factor to remember. The database set doesn't change. The input assays for the model are all OECD test guideline NAM assays. So they're aligned to the 442 CD and E test guidelines. And obviously these map to the skin allergy AOP that Emily was explaining a little bit earlier. The assays specifically that have inputs into the model are the DPRA, the kinetic DPRA, the KeratineSense, the USense, and the HCLAT as the NAM assays. Unlike some of the now hazard and subcategory approaches, which can use any of the approaches and assays within those guidelines, SARA ICE is fixed to just these inputs that I'm mentioning now, and you can't use an ADRA instead of a DPRA, for instance. You can't, or a LuSense instead of a KeratineSense, for example. So these are the fixed inputs for the SARA ICE model. And you can also use human data, so HPPT data, which is the human maximization test, or human repeat insult patch test data. And LNA studies may also be used, but as Emily mentioned, the model was designed to be used predominantly with NAM data, and so we'd advise not generating any new animal data for the purpose of use of this model. And then finally, in the model outputs. So SARA ICE is a Bayesian probabilistic model, and it gives you a continuous metric of sensitizer potency. It's a human relevant metric called the ED01, which is the 1% sensitizing dose in a human patch test. We then take this output of the model overall, and then there are two main versions of the SARA ICE, either the SARA ICE defined approach, which gives you a single point of departure, and that can be used under MAD, and that is the one that's included in OECD Guideline 497. There is also the SARA ICE extended version, as Emily and I have briefly mentioned, and that has capabilities to use the full distributions and GHS classification, but we're not going to focus on that anymore today because it's not an OECD guideline method, but it is accessible through the same tool. If anybody is interested, they can access it there. Thank you, Eugene. So I'm just going to now go through the specific metrics that we require for SARA ICE in a little bit more detail. So as I mentioned, SARA ICE is estimating a human relevant metric of sensitizer potency called the ED01. And in order to generate that output, you can use any one of these inputs. The OECD guideline specifies that you need a minimum of 2 of any of these inputs across 2 different key events. So that's the same as all of the other input to the hazard and the subcategory assays as well. So in terms of the human predictive patch test specific metrics, you would need your dermal dose in the study, the number of test subjects, and the number of test subjects sensitized. For the LNA, you would use an EC 3%. For the DPRA, you need percent depletion, and this can either be based on just cysteine or cysteine and lysine depletions. For the kinetic DPRA, it'd be the log K max. For the KeratineSense, it's the EC 1.5 and also the IC 50. HCLAT, the EC200 or the EC150 from the CD54 and CD85 markers respectively, plus the cytotoxicity measure, and then finally for the USense, the EC150 and the CV70. For the KeratinoSense, HCLAT and USense, if there was none of those sort of metrics were met, so you didn't have an EC1.5, you would input your maximum dose tested instead, because the model can still utilize that information to give an idea of potency. So you need all of these metrics for each assay in order to be able to run the model. And the last point I'll make on this is that predictions can be made on partial data sets. So you can use, as I mentioned, a minimum of 2, but then you can use any combination and up to any number of study types. So it does give you a level of flexibility to use the data that is available to you in quite a flexible way. Thank you, Eugene. So SARA-RICE DA specifically, so the OECD guideline version of the SARA-RICE model, derives a point of departure from that ED01 distribution. It's important to remember that it presumes that the substance under evaluation by the model is a skin sensitizer. So the assumption is that within your assessment workflow, you will have already decided, based on, for example, the 2 out of 3 approach, whether you do or do not have a sensitizer. And if you have a skin sensitizer, you would then use the SARA-RICE model to determine the point of departure and the potency. Because of that, the ED01 distribution has got this upper limit of 60,000 micrograms per centimeter squared, which is effectively the highest dose that could be used in a human study. So anything beyond that, if you're not seeing sensitization, is assumed to be a non-sensitizer for the purposes of this model. And then the point of departure is the mean of that distribution. And as both Eugene and Emily have mentioned, this is acceptable for use under MAD. Thank you, Eugene. So this is just a little snapshot of the performance evaluation that we went through throughout that OECD feasibility study and development of the model. So these are just 2 sort of reference data sets. So the DSA-1+, which is the dose per skin area that would sensitize a single person, and a set of benchmarks from the Irizar et al. Publication. And essentially all we're showing here is that the SARA-RICE POD is correlating really well with those other metrics of potency that we do have available to us. So our PODs are on average just 3-fold away, or 3.5-fold away relative to those benchmarks. And on these graphs, the red points are just points where you would, according to the available human data, you would predict them to be non-sensitizing. Thank you, Eugene. So this is just a bit of a visualization about what the model then looks like altogether. So as I mentioned, we've got the SARA-RICE database, which is a fixed database of over 400 chemicals. Then the Bayesian statistical model, which is a network of probability distributions, which describes the association between all of those different data types that I've mentioned. And the output of that is then the ED01 distribution, which is the 1% sensitizing dose of a human HPPT eligible population. We then take the mean of the distribution, assuming that it is a sensitizer, and that is the point of departure, which you would then use to input into your risk assessment. Thank you, Eugene. So this is just to give you an idea of the workflow before I hand over to Emily to sort of talk you through how we go about doing this practically. But on the left-hand side, you see the model configuration, which is basically what I've explained to you in that previous slide. And then for a user, you would have an Excel template where you fill in all of those specific inputs that I mentioned in the table in previous slides. With that chemical specific data, you run the SARA-RICE model, and just by loading that Excel template, and you get the ED01 estimate, which is that probability distribution. We can then take the point of departure from that, and then you use that in your risk assessment. So this is just the overview of that workflow, and I think I am now handing back to Emily.
Indeed. Thank you, Georgia. So what we'll be doing next is a quick walkthrough of how to actually access and use the Sarah ICE tool. So here we provide the QR code and also the link that takes you to the landing page for Sarah ICE. What you'll find here is the actual link into the tool itself, as well as some additional resources that help to benchmark, what the test method is and some of our historical evaluations, so different publications, a link to the guideline, things like that. So you would click on that, access the Sarah ICE tool, and next slide, please. That will take you into the actual Sarah ICE landing page. So what we have here to get you oriented with the different aspects of the tool, we have the basic instructions for how to use it right there in the center. So what we're looking at you doing is you have a user guide, and we highly recommend that you read the user guide before you actually use the tool, because there are some quirks and requirements in the input data that the tool will actually not run if you don't have things appropriately formatted in there. And the user guide helps to explain what some of those are. So you can download that user guide at that button that's there in the center. We also have a step-by-step workflow across the top, and what you can see is the green indicates what page you are actually on. Anything that is white is a selectable button, so you can go to that next page for the select input file. Anything that's gray, you can't actually do yet because it's relying on a step in the previous process. So what you would do there is you could click along the white, or you can just click next at the bottom. Additionally, you can get your input file and things like that on this page as well. And there's a link to the support email that if there are issues, you can email, and those come to the ICE support team, which I also help with, and we can answer those questions as they come up. Next slide, please. So a little bit of a closer look at the steps for using Sarah ICE. Again, read the directions. It sounds like we're, hammering home a little bit on that, but based on some of the questions that we get back, that definitely is very, very helpful. There's additional resources if you need to do that. And then again, you can go ahead and look at those different instructions. So next slide, please. So when you get to the select input file, this is going to be the first step of where you can provide data. At the very top of this box, you can download the template, and we can take a quick look at what that looks like soon. This provides the required formatting for the data input into the models. Georgia talked through what those required data inputs were a few slides ago. Those are also provided in the user guide with some additional guidance on how to handle things. Well, we know that it's less than X because we never actually got down to the we never actually got an EC150, but we know it's less than. So, how to do those different formattings for the different data inputs. There's also an example template. So if you're not quite sure how you want to use it, or you don't have data to input, but you want to try it, you can download the example file, and you can run that through the model to get an idea of the different aspects of the things that you can get out of it. Once you have got your template put together, you would click on the browse files, or you can just drag and drop your file into that dotted line box that's there in the center, and that will start the model evaluation automatically. Click. If you go to the next slide, please. Just a quick look at the input file. This is actually, we're just showing you the key. So again, the key provides a lot of that additional information on how to input the different data types, what things are absolutely required versus where things you can maybe not put anything in. Do not change any header names on the template file or any of the tab names. Don't delete tabs, anything like that. There's a check by the model when it first goes in to make sure that it's seeing everything it's supposed to see. So even if you don't have data on an LLNA, that tab still has to be there in the input file, or the model will fail. And it'll pop out hey, I'm missing this tab. Can you please put it back? Limit entries such as less than or greater than are permitted and should be used where relevant. You do have to have an entry in the substance name, the abbreviated substance name. They can be the exact same. You know, if you just want to say DNCB twice, that's totally okay. It does need an entry in the CAS-RN, but it doesn't have to be a CAS-RN. We just are using that because most entries will have a CAS, but you can definitely decide that you just want to call it chemical 1, and that's totally okay too. If you're using the KDPRA or the keratinosins, you absolutely have to have molecular weight in there. Otherwise, again, the model will not be able to evaluate those data. I guess next slide, please. So once you've filled out your template, you've uploaded it into the model, which as a note, it is locally run. That data is not available out to the general internet. Everything is running within your browser. So when you upload that, it's not an issue that it's being shared out. It is all locally run. For the purposes of this webinar, you would make sure that you have selected the OECD TG497 defined approach. And so you'll click on that. If you are interested in exploring the extended model, you would click on the extended model radio button that's right there, and that will give you the output from that instead. But again, for this purpose, we're only looking at the Guideline 497 version. Next slide, please. So during the analysis, this is what it's going to look like. It will run each chemical sequentially, so it can't run multiple chemicals at the same time. We're hoping in a future update to be able to allow for multiple chemicals running at the same time, but right now it can only do one at a time. So it'll actually indicate which chemical it's doing the analysis on by this running indicator within the results table. Those will populate as the model comes up with the answer, as will any of the visualizations that are put out by the model. So again, you can see what those look like, and then it'll just slowly auto-populate as you're going through. Next slide. Once the model has come out with the evaluation for each individual chemical, you will see on here that you have in the table, there is, again, that whatever substance name you put in there, whatever the indicator for the CAS was, it indicates your point of departure in micrograms per centimeter squared. So in this case, you can see that for substance short name, we have 4,700 micrograms per centimeter squared. And for a chemical, we have 1,300 micrograms per centimeter squared. You can see the definitions of what everything means below that table. We also provide that visualization of the EDO1 distribution. And so that's what we see over here on the right. And what you're actually seeing is the 5th percentile up to the 95th percentile. That's that thinner line. And then the 25th to the 75th, which is that thicker line. The bullet is the median of that distribution, and the purple vertical line is the point of departure geometric mean. And so that is what you're looking at. You can see, how wide your distribution is. That provides how, certain or uncertain in your prediction you are. Once that is done, you can go ahead and click next, and you can download your file. And you can either download it as an Excel spreadsheet. So what that will do is it will actually append all of the information that was derived from your analysis back onto that template that you provided initially. Or you can do it as a CSV formatted text file that will only provide the output and the CAS-RN of the chemical. So this is why it's important to have something in that CAS-RN so you can link it back to your chemical name. In Windows, there's a couple of quirks that, again, we're hoping to get fixed going forward, but it's just, unfortunately, sometimes apps don't build the way that you want them to. You may get an error that says there's an issue with the file. You can tell it to go ahead and recover, and it will open that up. If it doesn't, you can download the CSV file and then just move your data over into your template file. So if the Excel will not download, you can still get it through the CSV. And again, we're hoping to get that fixed in a future update. We are also going to be providing a PDF report in a update that should be coming. That update should be coming within the next couple of days, I hope. What that PDF will provide is a compilation of all of your input data as well as the Sarah Ice output data in a very nice formatted page that you could actually use for submission as opposed to, you know, just your Excel file for other analysis. Next slide, please. So I know I've mentioned some of these, but again, some very helpful troubleshooting tips, do's and don'ts for the app. And again, some of these may get fixed in future versions of this. And again, that's the versions of the app. That is not the version of the model. The model is fixed, the model will not change, but the app may have some additional features or things changed just to help better provide the information that the unchanging model can do. So the model can run on a single data input, but for MAD, you need to have two input types across multiple key events. So make sure that you have that in there. If you get a recovery error when trying to download the data, go ahead and click Guess Recover or go to a CSV. When you're filling in the input spreadsheet, don't delete tabs. Don't change any names on the headers. Make sure you have the substance name and CAS where you have data. So again, if you don't have data, don't put anything on that tab. If you do have data, make sure you have the substance name and the CAS. Otherwise, you might lose the evaluation going through. Read the key tab, fill in the short name, check your units, make sure that you're entering the right information, and input data for all headers for each data type you have available. If you don't have a data point, use a max dose tested as a surrogate or 0% for like a lysine where you have, if you don't have a lysine available. So just, you know, make sure that you're not leaving blanks on any of the input types when you do have input. Otherwise, again, the model will fail. Next slide, please. And that's back to Georgia.
So now you've had a bit of an overview about how we actually run the app so that you can get the outputs. We're going to just run through a bit of an example case study for a material to kind of exemplify that and put it into a bit of context about how it may be used in a risk assessment. I just want to caveat this by saying it is just an example. It is not based necessarily on any real information, and I think it's also important to say that this is a new approach and there isn't a huge amount of experience in applying these in risk assessment scenarios at the moment. So the scientific community is still building how much confidence and how we can do this in different ways. So do take this as just an example. But the case study we've selected is geraniol. Geraniol at 2% in a cosmetic face cream. So we've developed some example exposures here based on a sort of standard product use and skin surface area, and we have an exposure of 54.5 micrograms per centimetre squared per day. Using NAM data only for this example, we're going to generate that point of departure using the SARA-ICE-DA. So there's a series of input data here. As you can see, we've got the DPRA with cysteine and lysine depletion. We've got the kinetic DPRA, the keratin sense HCLAT, and USense assay. I've just put a little note on this slide to say, you know, we've got a lot of information in this case study and we've got a data point for each of the NAM inputs, but that may not be that realistic when you are doing an ab initio case study. You might just have one piece of evidence from each key event, for example. Next slide, please, Eugene. So we would run the SARA-ICE model as Emily's just demonstrated. We would have put all of that data into the Excel form, uploaded it and run the model using the user interface. And the point of departure you can see in the table on this slide is given as 3,200 micrograms per centimetre squared. Thank you, Eugene. Next slide, please. So then how do we go about actually putting this point of departure into a risk assessment construct? So we started to work and apply this. We're using the terminology acceptable margin of exposure. So this is a value above which a risk assessor may usually conclude low risk for their safety assessment. And we've developed an approach to define what a NAM pod equivalent acceptable margin of exposure would be versus how you would apply this in a historical approach, such as the QRA. So we're using QRA as an example of an approach here for application and risk assessment. And this was published in the ICCS best practice guidance, and that's got a really nice walkthrough as well about how you would implement this. So if you'd like to know a little bit more, we've not got loads of time to walk through it today, so that's a really good resource. Thank you, Eugene. So traditionally, uncertainty factors, for example, the SAFs that are used in QRAs, have been, for example, a value of 100 that have been used as this acceptable margin of exposure. And what we've done here is we're trying to convert that acceptable margin of exposure from what would have been a human-derived NESL, for example, into an acceptable margin of exposure for a NAM pod, such as the SARA ICE. So we went away and my colleague Jo Reynolds developed this and statistically analysed what the difference is between those human NESLs and benchmark exposures, so a set of consumer benchmark exposures which were known to be low and high risk. And we looked at the bias and error between those. And then we did the same thing between NESLs and NAM pods, looking at the bias and error of that as well, and we combine those equations. And essentially, for a risk assessor, what's really important is that the ultimate output is not this equation, it's this nice lookup table. So all you really have to be doing as a risk assessor is looking at what you would be using in your traditional approach, whatever that might be. So if you were previously going to use a uncertainty factor or a SAF of 100, you would then just use this lookup table to see what the appropriate value would then be for SARA ICE pods, or you can apply this for other NAM pods as well, once they're developed and accepted in the future. And for example, on this lookup table for 300, for a previous factor of 300, you would use 360 here. So this is really just translating what that additional uncertainty factor, if any, is needed to give you the same level of protectiveness that you would have had using a human NESL. In some cases, that may be the same. In some cases, it may be a little bit more. Thank you, Eugene. So this is just a side-by-side to quickly demonstrate how a traditional QRA, for example, workflow would look like versus what you would do with a SARA ICE risk assessment. And really all we're demonstrating here is that they look very similar. So you're really just popping that SARA ICE point of departure into the construct that you would have had for a traditional NESL. So where you would have derived the traditional NESL, you derive your SARA ICE pod, and instead of deriving, for example, a safety assessment factor, you would use that lookup table to define what your acceptable MOE is. And then you'd implement that either to calculate an AEL-CEL ratio, as you would have done in a QRA, or you can use other sort of risk assessment methodologies, for example, looking at your point of departure divided by your consumer exposure level, and then making sure that you have a number greater than your acceptable MOE. So we're really just showing here that you can implement it in very much the same way as you would have done with a traditional NESL. Thank you, Eugene. So then just back to the geraniol risk assessment here, with our point of departure of 3,200 micrograms per centimetre squared, because this was a face cream in cosmetics, you would, under the QRA construct, for example, use a safety assessment factor of 100. We'd also be using, via this lookup table, you would also be using 100 for the SARA ICE POD. And so when you know your exposure, which we do, you can calculate what your margin of exposure is, and then whether that is above or below your acceptable margin of exposure. And here our margin of exposure is 59, and our acceptable margin of exposure from that lookup table is 100. So in this case, we've got a high risk scenario. So that is kind of the end of the walkthrough case study. Yeah, thank you, Eugene. Next slide. And just to run through a couple of summary points. So SARA ICE is allowing flexible use of a range of OECD test guideline NAMs, as well as being able to use historical LNA and human data. It's fulfilling a gap in the previous OECD test guideline version for defining points of departure for risk assessment, and it can be applied in current skin sensitization risk assessment methodologies. There is another version called the SARA ICE extended model, which can provide additional information around GHS subcategorization and hazard, and the full and uncertainty distribution, but that is a non-MAD application. It's not within the OECD guideline. So if you want to stick to a version that is under the MAD guidance, then that would be the OECD 497 approach, which is the SARA-ICE DA. There are a few useful QR codes on here, and I believe the slides will be shared afterwards as well. So I think now we're going to move on to the Q&A. Oh, sorry, I didn't say thank you. I should say thank you first. Just to say thank you to the Unilever team, so Joe, Nikki and Gavin, and the Nicetum team, led by previously Nicole Kleinstra and obviously Emily on the call today. And then with a special thanks to the OECD expert group, the Secretariat, especially Eugene, and Miriam Jacobs, the UK Project Country Coordinator for the OECD. Thank you. Now on to the Q&A.
Thank you. Thank you for this great presentation. The step-by-step walkthrough and all these case study information, I think they were very, very useful. We have some questions on the Q&A. We have two questions regarding the GHS categorization, the function of the SARA-ICE. So already both Emily and Georgia mentioned that there are available this function, but for non-MAD purpose. But I'm not sure if Emily or Georgia would like to add a bit more the context, or that's a sufficient answer. Or you have a slide you want to share on that, or no? It's okay.
I mean, we can add just a little bit. Yeah, the model can derive those GHS classifications in the extended version. One of the ways that you could potentially use it is to determine if you think you do have a skin sensitizer by that weight of evidence, in order to then put it into Guideline 497 to derive the point of departure for that risk assessment. So we can use it to derive a hazard or a subclassification, but again, not usable under MAD or in that way. So in terms of whether or not you can use it with a regulatory package with your local regulatory authority, that would be up to them to decide if the extended model is sufficient. So it can be done in the extended, just not in the Guideline 497 version, because the 497 version is assuming that you're putting in data for a skin sensitizer.
Thank you, Emily. Okay, we have one question. Can we use this enriched dossier in Euclid, iEuclid? Emily or Georgia, or it's not clear?
I believe it's pending. I mean, Georgia, I think you know Reach better than I do. So I'll let you.
As far as I'm aware, we haven't done it yet, but I don't see any reason why it couldn't be. That is something that we can look into after the call, maybe respond to afterwards.
Okay.
Thank you.
Thank you. And the next question we have is when deriving ED01, would the model put higher weight on human nasal from HPPTS if available?
So the model is obviously it's a network of probability distributions, and so if you have any of the sort of animal or NAM data, it's sort of looking at the relationships for any particular chemical between all of those different types of assays and human data. Specifically for your chemical of interest, if you had a human HPPT input, it would really be dependent on the study itself. So for instance, what sort of dose it was tested at, the number of people sensitized, etc., as to how informative that is onto your potency overall. So sorry, it's not necessarily a straightforward answer, but no, but dependent on how informative that particular study is, it may be more informative than other inputs that you have.
Thank you, Georgia. Somewhat in the similar line, what would be your recommendation if differences are observed between the human nasal and the SARA-derived point of departure.
Sorry, could you repeat the question, Eugene? I was just trying to find it written down and my computer froze a little bit.
Yes, what would be your recommendation if differences are observed between the human nasal and the SARA-derived point of departure?
So I think personally for me, the benefit of SARA ICE is that you can actually go and look at how much uncertainty you have within your prediction. Again, similar to the last answer, it will be dependent on what your NESL's actually been derived from in terms of, for instance, a human study and how informative that human study actually is for the scenario you're in. But the benefit of being able to see this full distribution and the uncertainty that you have, because of that kind of weight of evidence and the sort of historical data that you've got within that database, I always like to personally look at the SARA ICE to see how much confidence I would have in that point of departure versus whatever you have for the human studies. So it would be dependent on your specific scenario, I think.
Thank you, Georgia. The next question is, there seems to be no GARD skin in the input table. Is it not applicable? And I think maybe just in general, maybe the question could be extended to other methods that are also from the 442 series, how they are perceived with respect to SARA ICE DA.
So right now with the SARA ICE DA, the only inputs that are available are the ones that the model has been trained on. And so that is going to be your DBRA, KDBRA, Keratinosense, HCLAT, and USense. Right now, GARD skin is not included as an input option, but that doesn't mean that in the future it couldn't be. But again, it has to undergo, we'd have to retrain the model, determine how well it's performing with GARD skin in there or any of the other test methods. If we want to put Lucens, ADRA, Episense A, any of the other ones that are currently included. We'd have to reevaluate how the model performs, determine if it's a useful input to the model, and then for OECD purposes, take it back as a new project with the Secretariat to get it reevaluated to determine if that new change is possible to go into the guideline. Now, all that to say, we do have the extended model, which is not under MAD, as we've tried to really emphasize. So we can also use additional inputs and trainings on that side to, again, see how well the model is doing. And that is kind of the plan of what we're looking at going forward is, maybe updating the extended version with an extended database, additional inputs, see how it does, get a feel for it, and then, really get it ready with a larger bolus to then take to OECD for future evaluation.
Thank you, Emily. The next question is on the applicability domain. What is the applicability domain of the SARA ICE database? Organics only, are metals and metal compounds covered, other inorganics?
Yes, so generally what we would advise for the SARA ICE model is if it's within the applicability domain for your input assay, then it is within the applicability domain of SARA ICE. So it's really dependent on the input assays that you're using and the applicability domain of those versus the chemical that you've got. If it's outside of the applicability domain of those assays that you're using as an input, you could still use it as an input into the model, but you just have to be aware that there would be additional uncertainty potentially on that value that you're getting out.
And then to add on to that, the training database does have a wide variety of different compounds in there, organics, inorganics, metals. There are some mixtures, there are some pharmaceuticals. I don't have the exact makeup memories of what it is, and that is actually something that we should probably have more readily at hand to remember exactly what those different product categories are. But it is meant to cover the wider range of chemistries that could be found within skin sensitizers. So that was one of the big updates between when Sarah Ice was initiated, bringing the ICE database in, was to update it from a consumer product focus into a wider applicability.
Thank you. The next question is respiratory sensitizers could also be tested positive in many dermal sensitization tests. How sure can one be that the chemicals in the database are all skin sensitizers?
It's an interesting question. I couldn't say for absolute certainty that no respiratory sensitizer had snuck into the database at all, but there is a huge database, and it went through a huge amount of curation, particularly at the level of ICE. Emily, I don't know whether you can comment on that curation process anymore, but it was scrutinized quite heavily, that database. So yeah, that would, I don't know whether I could say for certain that there are no respiratory sensitizers in there.
And to add to that, we have a lot of overlap between where there are respiratory sensitizers that are also skin sensitizers, and the question of how to exclude respiratory sensitizers that test positive in a skin sensitization assay has not been answered yet. And so it is really hard to say for those that are, dual sensitizers versus only respiratory sensitizer. We don't have that. What went into the database are things that were either negative or positive within the assays that were used to train it. So again, we do have that HPPT data in there, which is very helpful in the fact that we do know if it's positive in the HPPT, then it is going to be a dermal sensitizer. That is not the bulk of the database, though. I mean, it's a decent sized database from there, but it's, we have a lot of those other in vitro assays as well. So it's not really an answer to say that, again, like Georgia said, we don't know for sure that we don't have any just respiratory sensitizers in there, but that is a broader question for the broader community of how we really delineate between the respiratory and the dermal sensitizers at this point, which is another project that we have going OECD right now for there's a detailed review paper on respiratory sensitization that is being developed as we speak. So it's definitely a question that we have and that we're hoping to get some more answers on going forward.
Thank you, Emily. This question, are there ongoing talks with ECHA to include it into the CLP guideline?
Not at the moment, no. But again, Emily's kind of mentioned this, that we aren't going to stop here in terms of the development of SARA ICE and its application. So again, with the extended model being able to do GHS classification, it is something that we would hope to gain acceptance of a regulatory level in the future.
Thank you. Could you elaborate on identified limitations? Could it be used for skin irritating corrosive chemicals as well as more inorganics?
I think it's probably a similar answer to the applicability domain question. So again, it's probably in terms of that question limited by the applicability domain of the input assays that you've got. I don't know, Emily, if you've got anything to add to that.
Yeah, I mean, it's the same limitations of is it an irritant or not when it tests positive in an HCLAT assay? So yeah, I would just look at what the applicability domain is and apply it that way.
And it probably is similar for mixtures, because there's a question about how you test for the mixtures. It will depend on the method, the applicability domain.
Yeah, so all of the 442 series test methods have not, there is that caveat in there, like you can do it in mixtures, but so they all have that caveat, and it's the same with SARA ICE. Like, yeah, we haven't necessarily formally evaluated it in mixtures, but it's feasible to do it. whether or not you need to do it on the individual components or on the final formulation, that is again dependent on your needs for what you're trying to do from a risk assessment standpoint. If it's the final formulation that you really want to have an understanding on whether or not that is going to be the sensitizer, that is where you're going to be doing your assessment with that formulation versus if you are trying to determine what your top dosage could be of a chemical within that formulation, then that would be where you would look at the individual components. And then SARA-ICE can do that because it's, again, with what the input data looks like.
And I think like Emily's quite right in terms of the context of use. And I know that the scientific community is working quite hard on this question to try and get some clarity on where these assays are useful for mixtures and where adaptations are needed.
Thank you. And there's a question on the availability of the SARA database, and it is available on the NICEDM website.
Yeah, and it's in the Reinke et al. Publication as well as supplemental materials.
Okay. One more question is, do you compare results from this model to an animal study? But it's also an input, so I'm not sure. Yeah.
We do have an evaluation of how the SARA-ICE POD. Yeah, we did it against the LLNA too. I believe that's in the Annex 11 of the supporting documents that we have that comparison, so you can see how well it does against the LLNA EC3. Trying to remember if we did it in the IT paper, if we did that comparison too. I can't remember off the top of my head.
I think possibly only for the GHS classification part of the model, and not for the point of departure itself.
But we'll have some, we're working on an additional publication that will have some comparisons to the LLNA as well.
Thank you again. That seems to be all questions we have. Just I forgot to share the last slide because there were some inquiry on the recording of the webinar. So I hope you can see the slide. It lists all the websites where you can visit for more information of the OECD work regarding chemical safety. And the webinar will be uploaded on our YouTube channel. You see there, so it will be available. Maybe before closing, I just had one question. So this Bayesian statistic framework, is there other endpoint where this framework could also be useful to get either the point of departure, the risk assessment value, or also for the classification? Are there any other follow-up on this work or another endpoint?
That's a Georgia question.
What exactly are you referring to there, Eugene, in terms of the framework?
So Bayesian statistic modeling, basically. Can the DIP that uses...
we use this approach for anything else?
Bayesian statistics,
not this exact approach currently, but the Bayesian modeling and probabilistic modeling in general, yes, we're at Unilever, we are developing approaches for systemic risk assessment. So there are a number of publications from my colleagues. I would recommend looking at the Cable et al. Publication from this year on our toolbox, but that uses an approach not the same as this, but uses similar thinking to try and solve NAM-based PODs for risk assessment more broadly in systemic risk assessment.
Thank you, Georgia. I just checked for the last time that I didn't miss any question. So there seems to be... Okay, there are more congratulations, except well, there's a question. We still have a bit of time, so there's a question on how you found the MOE 59 and concluded high risk in the geranio example. Is the question?
Yeah, so I guess in its most simple form, we had a point of departure of 3,200 micrograms per centimeter squared, and it was just dividing that by your substance exposure that we had calculated. Thank you for the slides, Eugene. I was looking over the slide. It's really just if you look at the flow diagram on the right-hand side here, you could do this in two different ways. So you could either look at your acceptable risk through defining an acceptable exposure level, which would be your exposure divided by your acceptable MOE and then divided by your consumer exposure level. Or you would have your POD, so that 3,200 divided by your consumer exposure level being that 54.5, and then looking, which is the 59, and then you would see whether that was greater than your acceptable MOE of 100. So it's just a division of your POD by exposure, really.
Thank you, Georgia. If anyone has more questions, this is your chance, because we have Emily and Georgia with us for at least for another 10 minutes. So if you have questions, please don't be shy. That's really the purpose of webinar, is for you to be able to direct these questions to the developers and get some clarity.
There's a couple of questions in the chat box as well.
Okay. Thank you, Araceli.
I've just seen one on sharing the publications for the systemic tox POD work. So yes, I can absolutely share that with people. I'll find that and pop it in the chat.
Okay. Very good. And then yes, the certificate of attendance for the webinar, I will have to ask, but it may be possible. Okay, final comment then. Does the model assume direct relationship between the potency and the percentage of a population expected to be sensitized?
So the metric itself that's being derived by the model is a 1% sensitizing dose. So yes, it is looking specifically at how it's translating through those probability distributions from all of the different input assays, how that then translates back to a human 1% sensitizing dose.
Thank you, Georgia. Okay, no more questions. Q&A. Yeah. Well, I think then that was it. Yeah, I don't see any more questions. So, well, thanks. Again, thank you very much, Georgia and Emily, for your time to walk us through this big achievement and the great work in addition to the uptakes of NUMS for the regulatory use. And I also want to thank the attendees for participating at the webinar today and for all the questions and making this webinar a lively event. Well, we're 10 minutes ahead, and it's never a bad thing, so I'd assume. So again, thank you everyone, and have a good rest of the day wherever you are. And we hope to organize another webinar at OECD when there's a presenting case. And yeah, as I showed here, you can stay in touch with us through many different ways these days. So please keep in touch. And yeah, thank you very much again. Bye, everyone.
Thank you. Bye.
Bye.